5:06, let's get to the latest on the monkeypox outbreak. It's now been reported in 79 countries, and New York City is the latest place to declare a public health emergency.
Right now, the monkeypox virus is disproportionately impacting men who have sex with men, but anyone can catch monkeypox, and doctors say it primarily spreads through skin-on-skin contact. There are growing calls for the Biden administration to declare monkeypox a federal health emergency, which would free up more funds and resources to fight the outbreak.
And here's a look at monkeypox case numbers here locally. In Virginia, there are 94 reported cases, according to the state health department. Maryland has 117 cases, according to the CDC, and D.C. has the most cases locally at 218.
And as D.C. continues to report the most cases locally, the Department of Health is opening a new vaccination clinic today in Ward 8.
Let's bring in Jess Arnold now. She is live outside the D.C. Department of Health with everything you need to know. Jess, good morning.
Good morning. Yeah, now those shots are still appointment based. So if you have an appointment at DC's new Ward 8 clinic, you should probably already know about it. But DC is expanding that access, opening that clinic today, and in hope to make it more accessible for everyone throughout the district. Now, here's what we know right now in terms of districts' cases and shots as of the end of last week. Now, this is coming from the Department of Health. Now, they have already administered more than 7,000 doses and sent more appointments out on Friday. They said they pre-registered more than 18,000 DC residents so far, and they sent out about 14,000 booking invitations. And they identified and gave shots also to more than 500 close contacts. Now remember that DC Health announced last week that they're moving to a one-dose regimen for now because of a supply shortage, but they'll update eligible people when they can move back to that two-dose regimen. Now any district resident can register for the shot right now, but because of that shortage, DC is limiting who can receive it to the LGBTQ community, sex workers, and staff at any facility where sexual activity occurs. Now again, this disease is not an STD and anyone can catch it. In DC right now, there just happens to be a larger concentration of individuals who are catching it in those communities. Now here's a review of the symptoms. We're throwing up that graphic for you. Fever, headache, muscle aches, swollen lymph nodes, and of course that rash and lesions on the skin. Now again, it's spread through direct contact with that rash or lesions, that close face-to-face contact, because it is airborne. It just doesn't linger in the air as long as the coronavirus does, according to a DC health official that we spoke with last week. You can also catch it from touching a fabric that an infected person has touched as well. Now DC Health says they'll update with more appointment invites as soon as they get more supply. And again, we're still waiting to see if and when they can move back to that two-dose regimen. Send it back to you guys.
Jess, thank you so much. For more information on monkeypox and to see how you can get a vaccine, just go to WUSA9.com, or you can text the word monkeypox, just one word, monkeypox, to 202-895-5599. We'll text you back with some links to the latest information here in the DMV.